Hello everyone, I'm Alex. In this video I'm going to talk about advanced editing features in RIL-Contour. I'm going to talk about two editing features. The first is thresholding and the second is hiding and freezing ROIs. So let's start with thresholding. So you'll notice that the anatomy here, actually some organs appear much brighter than others. So this actually means that we can use a thresholding tool to make segmentation much easier. So let's zoom in on the kidneys here. I'll also add this is a contrast enhanced scan. So this patient had something like gadolinium or iodine injected into the bloodstream, and that causes organs with high perfusion, such as the kidneys, to show up very bright. So to apply the threshold tool, we'll go to Window, Paint Settings, and then this bar down here, Mask and Threshold. So if we click on this, it expands the menu. Right now it's disabled. If we select Enable, we now have the option to specify an upper and a lower bound. These lower and upper bounds are measured in Hounsfield units, which is a measure of how the tissue in question actually absorbs X-ray energy. So we could go on for a long time about Hounsfield units, but just know that these pixel values are meaningful, and actually they're pretty consistent from scan to scan. So if we mouse over the scan, you'll notice that the fat tissue here, if you take a look in this bottom right corner, if we mouse over the fat tissue, it has a value of about -100, and the kidney has a value of about 150. So we can select a lower bound of 0, and the upper bound of 1,000 is probably okay. Okay, so we now activated our threshold. So if we click on the ROI, select the paintbrush tool, you can see that we're only painting over the brighter pixels, the pixels that are between the upper and lower bound that we set. This is kind of a tough example because this is a very lean patient. Actually, for obese patients, it's pretty easy to segment using the thresholding tool. And left click to clean this up a little bit. Okay, so that's how to use the thresholding tool. The other thing I want to show you is freezing and hiding ROIs. So we'll close. So first we'll turn off the threshold, and we'll close out of this menu here. So now, if we select the pancreas, and so now I'm not going to segment the pancreas, I'll just trace next to it. But you'll notice that as we trace this ROI, actually we're covering up the kidney. But sometimes we might not want to do that. So for example, this kidney slice looks really good, so we want to just lock this in and not make any changes to it. So to do that, if you right click on the ROI in the menu down here, select Lock. Now you notice in the upper left it displays that the kidney is a locked ROI. If we go back to pancreas, now we can trace all over the place, but we can't change our kidney. So this is a really convenient tool. Once you get the hang of it, you can go one organ at a time. If you're segmenting multiple organs, and you can lock them when you're done, and it makes it way easier to trace over the anatomy. So between these two, the thresholding tool and locking the ROIs, you can save a lot of time in your segmentations. Just be sure that you remember which ROIs you've locked, and you can unlock them too. All right, that's it for now. Thanks for watching.